Good morning, everyone. Dr. Dan Graham coming back at you once again from downtown Gilbert Healthcare with our resident expert on health, Dr. Alan Bradford. And Doc, we are seeing patients that are coming in that are sneezing and coughing, and we are going to be talking about the dreaded allergies today. So,
Yeah.
what's on the docket today? What can the good Dr. Bradford help with people that are coming in sneezing and coughing and having watery eyes? And also, if you can answer, how does this affect other parts of the health of the body? So,
Yeah, absolutely. So allergy season or whatever you want to call it. Some people have allergies all year long. Some people coming into springtime and certain times of the year, it gets worse. Used to be, people would come down to Arizona to get away from their allergies. I don't know that that's the case anymore. But allergies can be a real big problem for a lot of people. And if you're not one to want to pop, allergy pills, nasal sprays all year long. There's things that we can do to investigate, to see what you're allergic to, and then some therapies to use to get over those. Um,
so testing. What when someone comes into you and say, "Look, I'm just kind of feeling, not good,
yeah.
having some allergic reaction issues with the environment, or maybe even foods." How do those tie in together? What sort of testing can we offer?
So I do different testing for environmental allergies as opposed to food allergies. Environmental allergies, you can get a real good handle on that doing just a standard blood test, or even if you go to an allergist and do that skin prick test that a lot of people are familiar with. With those, you're looking for what's called an IgE reaction, so that's a certain immune system reaction to something in the environment. If we're talking about food allergies, which can also show up as symptoms like stuffy nose, runny nose, itchy, rash type stuff, gastrointestinal issues. There's over 200 different symptoms that are connected to food sensitivities, so that's even more kind of a hidden thing. They don't always show up as like symptoms that you would expect from an allergy. So there's different testing that we can do for food allergies and food sensitivities.
Now, when we talk about food sensitivities, can allergies and food sensitivities add to your reaction to environmental allergies?
I think so, because you're putting a burden on your body, right? And you're causing the liver, causing the digestive system to kind of go on the attack if it's a food that you're sensitive to or that you're reacting to. So that energy gets diverted to working on that, and maybe not so much. It just your body gets overwhelmed. So yeah, if you're having food sensitivities, that can, I think, exacerbate or make worse, environmental allergies. To deal with that on top of that.
Now, one of the bones I'm going to chew with some of these allergists out there is that when we do some of the testing for food allergy or for environmental allergies, one of the problems that I see is that they'll tell you, okay, you're allergic to Bermuda grass, you're allergic to ragweed, you're allergic. So unless you actually move,
Yeah.
you're going to be relegated to steroids, antihistamines, different things. But what you alluded to, a fact of that, different allergens and sensitivities will overwhelm the body.
Yeah.
And if we can, is it true that if we can treat some of the more minor issues, then we're taking away some of those stresses on the body, and it'll overall affect how we react to the environmental stuff?
Yeah, absolutely. That's something that I've seen in practice. If you get those detox pathways running really well, that happen primarily in the liver and the gut, then your body's able to handle more things. And there's another therapy too that I've used with patients, specifically for like environmental allergies. It's something called SLIT therapy, SLIT. It stands for sublingual immunotherapy. A lot of people are familiar with allergy shots, like in the arm. Go to an allergist, get an allergy shot every week. I actually did that growing up in Oregon. A lot of stuff blooming up there. Slit therapy is a little bit different. So you're actually doing drops or like a spray under the tongue as a way to kind of retrain your immune system reaction to allergies. So it's really cool. It's not a quick fix. Sometimes that therapy can take a couple of years to really notice a profound effect. But I had a buddy that did it. He had really bad seasonal allergies. He did it for 1 year. He said that following year, after doing that slit therapy for a while, he's like, this is my best year ever.
Nice.
You know, he wasn't reacting. He wasn't popping allergy pills all day long. So it's a way to retrain your body's kind of violent reaction to an allergen.
Okay.
And you don't have to move. You don't have to uproot your family. You know, your body can learn how to not be so reactive.
Right. And I think that's important too, because isn't it true that if we have an overabundance of an allergic reaction, like a sinus issue, then it can also leave you open to sinus infections?
Yeah, absolutely. And, you know, sinus infection, the go-to therapy a lot of times in standard medicine is antibiotics. So you get desensitized there with antibiotics. It throws off your gut flora, which then causes digestive problems. And when you kill off the bacteria, that gives the opportunity for viruses and funguses or funguses, that's not a word.
There's a fungus among us.
Fungi. So those can overgrow, and you could potentially even get like a fungal infection in your sinuses, which can be a little more difficult to treat. So, yeah, I mean, if we get the gut right by addressing food sensitivities and allergies, it makes it a lot easier to address respiratory issues and upper sinus issues and stuff. So,
Now discuss, I brought my son to you, and he had a kind of some eczema spots that were remaining on his forearms.
yeah,
And they would flare up, especially with heat or when he was washing dishes, at work. And you did specialized type of testing, which I hadn't heard of before, and you found that he had some sensitivity to potatoes,
Right.
which we've never heard in all the years of having this kid tested. And so he reduced drastically the potatoes. So he'll still have,
yeah,
some fries and that sort of thing, hash browns on occasion. But it was fascinating because as soon as he dropped that food down in his diet, we didn't have to put anything on his arms. It just cleared up.
yeah.
So tell me what was happening.
So the skin and allergies, a lot of time, and I mean, it happens in adults too, but a lot of times with kids, or like pediatric population, stuff will show up in the skin, like eczema, weird rashes that come and go. The skin is an organ of elimination. We don't think about our skin as an organ, like the liver or the kidneys, but it's an organ. And it's a pathway for our body to be able to release. So if you're already burdening your liver, already burdening your kidneys by this constant kind of introduction of something that you're sensitive to, your body's going to get it out somehow, and sometimes that shows up in the skin. So my thought process, anytime I have somebody come in with like a rashy history, I immediately think, like, where's your digestion? What's happening there? What's happening in the gut? In Chinese medicine, every organ will manifest in another organ. And so a lot of times, like liver issues will manifest in the skin. So I immediately think, like food allergies, what are you putting in the tank? And how is that affecting your skin? Yeah.
All right, Doc. Well, I'm going to go ahead. So if someone is having some issues, they come in, they make an appointment,
Mm-hmm.
and you figure out which type of testing would be best in for each patient.
Yeah.
Correct?
Yeah.
And then once we get the results, you consult with the patient again, and then what's the process after that?
After that, a lot of times, if it is a food or if it is an environmental allergy, we go kind of different routes. If it's an environmental allergy, maybe proposing that slit therapy. If it's a food sensitivity, we kind of put together a plan of how are you going to eliminate these things for a certain period of time. And then, depending on the test we've done, there might be opportunity to reintroduce certain foods and see if you're still reacting. In that meantime, proactively doing things to help heal the gut. There's oftentimes, if somebody comes back and they're reacting to several different foods, we give the body a break, we do some things to heal the gut. 6 to 8 weeks later, we can reintroduce foods one at a time and see if they're still reacting. If they're not, then we can get those foods back into the rotation. If there are, we might need to do some more work. So it's fluid, you know, and it's individualized depending on the patient. So
Interesting.
Yeah.
All right, Doc. Well, we appreciate your time this morning. And for anyone who wants to get with the good Dr. Bradford about food allergies and environmental allergies, then by all means, downtowngilberthealthcare.com, 480-219-6354. Doc, we'll see you next week.
see you.